Hello everyone, and thank you for joining this short training session on Microsoft Teams. My name is Augusta and I work as a management coordinator at Cornbrook Medical Practice. Today we're going to look at how to get the most out of Teams, not just for messaging and video calls, but also as a powerful collaboration tool within general practice. So I'm going to talk about how you can effectively use Teams in your day-to-day work to improve communications, reduce reliance on email and support better teamwork. So an example of this is one of the benefits of Teams is you can use it on your phone or your laptop, which is particularly useful for the chat function where you can just get quick updates about things, unlike emails, which can be a bit more labour intensive and intrusive. So today I'm going to talk about three main functions of Teams, which are the chat, and that's divided into your individual messaging, group chats, so you'd have a whole practice one or a clinical team or certain working groups, and then you can also just chat to yourself, which I'll talk about on the next slide a bit more. And you can also do video meetings, and again, these can be in groups or one-on-one, and you can share your screen and share documents. So that's really useful. And then the main thing that I'm going to talk about is using channels, which are the sections that your teams are divided into, and it allows you to organize your files and information into specific areas within your practice team. So now we're going to look at the specific functions. So this is just looking at the chats, an example of my chats. So first we've got the group chats, so you can have your whole practice team, and this would be a lot of general information, so stuff like if there's going to be a fire alarm, if someone in the practice called a patient, they phone back and you don't know who it is, you can just send a quick message and you can direct them to the right person. It's very useful for us at Cornbrook because we're a multi-site practice. So if you don't know where you're working the next day or in the morning, you can just send a quick message on the chat and someone can look on the system and let you know. So that's where it's really useful that you can do that on your phone and you're not necessarily having to log into your emails or emails or whole big system. And then you can also obviously have work specific chats like reception group, so if we need to cancel appointments, we can arrange that without everyone having to know it, GP teams or pharmacy or certain working groups on things. And one chat that we've got that's really useful is this here, the clinical updates and alerts, and that is used for if it's something, it's an update basically, like it says. So if there's been a change to a referral pathway or something like that, and you just put it on the screen, so the next time someone logs in who's in that chat, they get that information and it's not filled up with you need to move your car, there's going to be a fire alarm and those things that can clog up the chats. And then there's individual chats, obviously that's just general messaging. If you need to ask a query about a patient, something like that. And then the final one is the chat to yourself, which is sort of like a notepad messaging board, and you can attach documents, or it's quite useful if you're sort of drafting a message or you just want to find a phone number for later. So that's really useful for that. And you can pin messages to the top like I've done with the Cornbrook and my chat, or you can make a message urgent, which you just do down as you send the message. So now I'm going to talk about how to create a channel and open versus lock channels, how to do this and what this means. A channel can be open, which case it's anyone in your team has got access to that channel and all the information and files within it. Or it can be locked, which is probably something you'd use for something like HR files, maybe operations management, something like that, that not everyone needs to have access to. So to create channels and add people to teams, you need to be an owner and if you are an owner, you can make other people owners. So that's probably your practice manager. So if you need that access, just let them know. And if not, ask IT. And yeah, I'm going to show you a few examples of the channels that we've got at Cornbrook now. So this is just an example of all the channels we've got in the practice. And some of them are stuff that's used daily, so things like general information, reception for the reception team, and that's just stuff where you need to check something every day, documents that update, looking at the rota, things like that. And then there's also a lot of channels which are really important, really useful to have, and they've got sort of stuff that's more compliance, QC related. So that's stuff like audits, SEAs, policies, but they're in one place and everyone knows where to find them and everyone's got access. So everyone can look at the policies and everyone knows where to find, say, this health and safety information or SEAs. So that's really useful because it's in one place and it's got access to all your documents and all the practice can access it. So now I'm just going to take you through a bit more of an in-depth look at the channel features. So things like locking files, sharing files, and allowing specific access. So how to lock a channel. So that's when you're creating an open channel for all the practice or a locked channel. And when you create a channel, you need to decide if that's an open channel or a locked channel. You can't go back and change it. But it's a relatively simple process to do that. So again, your open channel is something you want everybody to access, general information, policies, things like that. And then your lock channels, HR, stuff like that. So you go to your main Teams menu and you just want to add a channel here, and then this screen will pop up and you can make it private or open. So that's how you do that, but just remember to decide when you're creating the channel and that will work. So if you have created a locked channel and you need someone to access some of the files, you can still do that. So an example where we use this a lot is setting up people's HR folders. Obviously, you don't want everyone to be able to see everyone else's HR folders, but staff need to be able to access their own, particularly when they're starting and they need to fill in all the details. So how to give people access is you right click on the document and then you go to manage access here. Then it'll bring up this box and just up here there's that grant access screen, and then you just type in who you want to have access to the screen, to the document like that. And once you don't need them to, you can just stop sharing here. And so that's useful for HR, or if you had a locum working in the practice for a week or so, then you can just share them the relevant documents, and then when that's no longer relevant, you can cancel it. So looking at other features of Teams channels, one of the benefits of storing your documents on Teams. So like I said before, everyone has access to them and knows where to find them, but they also save automatically and they update live for everyone. So if one of your colleagues is, you and one of your colleagues are working on an audit or something together, then they've updated something, you'll be able to see it and you're not duplicating work. So that's really useful, and obviously saving automatically so you don't get lots of different versions of the same document. And you can just write any document that you want to share, you just right click it, send it to a colleague, and you can also pin documents. So if there's something that you use a lot, like I know reception have the rota pinned, something that you're opening all the time, you can just pin it to the top, and again that's by right clicking. And then we're going to look at how to embed websites and directories on the next slide. So in order to embed a website, which will just be a little tab at the top of your Teams here, and it will just be a link to that website rather than having to go through a longer route. So to do that, you just go to your Teams channel, click on this add button, go to apps, and then there's a big variety of apps you can use that do all kinds of great things, but we're just going to look at a few of the most simple ones. So the websites, the easiest, and it just brings you this pop-up and you can just type in your website here. So this example is the DBS checker website. So when we're setting up a member of staff on HR, then that's where you know to go. Other ways it's really useful are training platforms and your holiday booker. So those kind of sites where you're like, oh God, which one do I use for that? And it's just there on Teams and it takes you straight to the login site. And also it's really useful for lots of clinical things as well. And directories, so that's another app that's added the same way, and it's called a list. So you just want to create the list, and then you can use it for something like a hospital departments or staff phone numbers. And this is an example of, I guess, our like troubleshooting daily things. So it's really useful to have those in one places. Departmental email addresses are really handy, and that's just a really nice way of keeping all those things together. So finally, I'm just going to talk about keeping Teams tidy. So if you're the person that's responsible for the admin of your teams, it's really important to do a regular tidy up and make sure there isn't old stuff there or it's not immediately accessible. So I tend to do this at the end of the year, and just one of the easiest ways to do this is create an archive folder, and you just have archive, then 2025, put all last year's documents in, and then they're still there, but they're not the first things that people are seeing. So if you say wanted to look at what SEAs or complaints you'd had over the past years and do a comparison, then the information's there, it's easy to find, but it's not the first thing that people are seeing. So that's really important, and it's a nice bit of housekeeping to do at the end of each year. And then the other thing while you're doing that, and obviously there's going to be loads of people uploading stuff onto Teams, so it's really important that files are labeled in a way that anyone could access and understand. Teams organizes stuff alphabetically. So just be mindful of that if it's something like meetings and you've got one a month, then there'll be an alphabetical order, not date order. So you could do a reverse dates ordering, or you could label them numbers in the month, and then they'd organize chronologically, which is often much more useful. And then finally, there is a search function, so you can just search what you're looking for. If it's something that could have gone anywhere, like often there'll be some sort of leaflet that somebody shares, and you think, God, where did I see that? And you just search for it, the top of Teams, and it will show up. Thank you for listening and watching this training. Thank you.